in 2005, 2006, the state of Massachusetts passed what is known as Romney Care, which GBIO had a very interesting hand in making that happen. But essentially, upwards of 500,000 people who did not have health insurance got health insurance. And since that time, GBIO has really been on the forefront of making sure that the progress made with that initial victory is not lost. The problem now, we've made all this progress, and 99% of the state of Massachusetts has insurance, and the state of Massachusetts has one of the best healthcare systems in the world. The problem now is that healthcare costs are rising at an unsustainable rate. Legislation passed last year as a result of GBIO involvement, which basically said the increases in costs to consumers from hospitals, providers, and insurers cannot grow faster than the rate of the economy grows at. So that legislation is a good thing, and by all accounts, it's going to really keep the system from pulling apart. It's predicted to save over $200 billion over 15 years. There is a slight weakness in the legislation, namely the enforcement mechanism. So that's where GBIO stepped in, saying, we understand this legislation is a good thing, but we also understand the enforcement is weak. So we're going to ask in a year from now, they said this when the legislation passed last September. So they said, we're going to ask in a year from now, in September of 2013, that all the big hospitals and insurers come and meet with us and tell us how they've been doing. So this was an action where we were going to bring all the big healthcare players in the state together and all the big government entities in healthcare together, put them in a room together and just kind of shine some light and say, what have you done in the last year to adhere to this legislation, et cetera, et cetera. So at the very end of the action, this very charismatic GBIO leader gets up and gives this very impassioned speech and says, in 2005, when we realized people needed insurance in this state and we saw an opportunity to jump in the game and make it happen, we, GBIO, said, and then he points to the audience, and the audience in unison, all 190 people go, we are here. And then he keeps going and he says, and in 2006, when yada, 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 we, GBIO, said, and he points to the audience, and the audience goes, we are here. And he does that with all the actions that GBIO had done in the healthcare field for the past 7 years up until the present day. And then we get to 2013. And he says, but we're not out of it yet. So we pledge that we're in this for the long haul. So GBIO, stand up and say, and then everyone in the audience, all 200 people, stand up and in unison say, we will be here. And then he begins this call and response with the words, we will be here. So he says, and 1 year from today, we're still in this game, so 1 year from today, we're going to ask these hospital CEOs and insurance CEOs to come back, and we say, we will be here. But as the audience is saying, we will be here, the CEOs who were sitting on the stage got so caught up in the energy of the action that they actually stood up and said, we will be here. And they weren't supposed to do that. And so the guy turns around and goes, we haven't asked you yet, sit back down. And then they sat down, and then we asked them, and they said yes. But it was just this incredible energy in the room, and it was so compelling, enough so to get these 8 CEOs of, entities that are in some senses charged with making a profit and staying above water. Get them to commit to coming back to an action where they had to be accountable to a legislation that was in many ways decreasing their stream of revenue. And the fact that the energy was so intense that that was a voluntary thing and that they stood up and said it themselves without having to be asked. It was just incredible. It was an amazing moment.